Joining us now is Corinna Lau, and we're going to be talking about our pelvis. That's right, our pelvis. She is a physical therapist, and I'm happy that she's joining us here today. How are you today?
Good, thank you, Donna. Thank you for having me.
So we were making a joke, Elvis the pelvis, and you were telling me, though, that you used to do Elvis impressions as a kid.
I did.
Okay,
I did.
Tell us about that.
My grandfather loved when I used to curl my lip and say, "Thank you very much. I'm out of practice. I don't think I can do it."
I can do it. Like,
I can do a little bit.
I can do it. But I think he did it with the other side, and I can't do it on this side.
I can only do it on one side as well.
I can only do it on one side too. I was like, we have something in common. we actually have a lot in common. We're both moms. What made you decide to, focus on this? I thought it was fascinating because you've done all types of things in medicine.
Right.
So let's talk about your history.
Yeah. So I was always interested in science, thought I wanted to be a doctor. And then my last year in college, I decided I wanted to go into physical therapy. Went to physical therapy school at Columbia University and started working in a hospital, was working in ICUs, people with transplants, and then I had my first baby. And as a physical therapist, I was like, yeah, I can rehab my body. Like, this is going to be okay. And I went to go step over my ottoman at home, and my whole pelvis just shifted. And I was like,
was that painful? Or you just felt it?
It was surprising.
Okay.
It was painful. I was not expecting my body to react that way at all, especially because I was an exerciser during pregnancy, before pregnancy. And it was just such a wake-up call for someone being in the rehab and therapy field to not even know what was available to me when I was feeling these shifts in my pelvis.
Okay.
So I started kind of diving into the pelvic floor specialty, or like a sect of physical therapy, and taking my courses, doing my continuing ed, and just so I can further serve women pregnant and postpartum. But pelvic floor physical therapy is so much more than just those two things. It's really any kind of pelvic dysfunction, whether it's like pain at your pubic bone, pain in your low back, hip pain, and then all the other things.
All comes from that region. So interesting.
It can, yeah.
And I think that a lot of people do not pay attention to that. I don't really think about it very often. Right? But when you're pregnant, they tell you to do your Kegels, which are, you're supposed to squeeze your urination muscle, right? And keep doing it like 10 times a day, and then you're supposed to have pelvic health for life. Do any of us do that? I don't. Do you?
Right.
Do you?
I didn't.
Who does it? I mean, So go ahead.
Yeah, so the Kegels are fantastic, but it's so funny because a lot of my patients are like, so like a Kegel. I don't focus on the word Kegel a lot because a lot of times pelvic floor dysfunction is from tightness in your pelvic floor muscles.
Oh, really? So I did not know that.
Right. So the Kegel
building that muscle isn't that important.
It's
supposed
not
to relax.
Exactly. It's the whole cycle. So it's the contraction and the relaxation. So doing Kegels all the time may not be the answer because you might already be tight.
I don't feel bad about not doing that. So maybe it was okay. My laziness maybe paid off. Now what we have here is we do have a diagram, not a diagram, we have a unit, a model. And so the bottom part, the red part, is our bladder, and the top blue part is the uterus.
Correct.
So this is a female pelvis, obviously. So when the baby enlarges in our uterus, then it pushes on our bladder.
Correct.
And if too much pressure goes down, then we could lose our floor. Is that correct?
So so what happens is that baby's growing at a certain point in pregnancy. Obviously, this is a small space. That's not a huge space.
No.
So any kind of growth affects what's going on in there. So as the uterus grows, it comes out of the pelvis, puts more pressure on the bladder. The other key factor or coordination in pelvic health is pressure regulation. So as this load is getting bigger and bigger, we want our pelvic floors to move as our diaphragm moves, which is the muscle that lines the top of your core, essentially. Okay. So if that pressure is regulated, hey, our pelvic floor can contract against gravity, relax against gravity, we may not have any urinary symptoms.
Okay.
If we're constantly contracting or we're kind of changing our breathing pattern and affecting that pressure inside of our core, it could affect our pelvic floor muscles, which in turn won't be as supportive when we sneeze,
Okay.
when we jump,
so if
when
you're
we cough.
having urinary incontinence, right? So if you're jumping and you're urinating, or if you're coughing and you're urinating, unless sadly you have COVID, because I heard a lot of times people that have COVID, when they cough, they're incontinent.
Yes,
Did you hear
definitely.
that? Like,
Totally.
Like, what I didn't know about the COVID virus is you have to wear Depends. I mean, who knew? So anyway,
one of the many complications.
one of those many. Okay, but so if you're coughing and you're urinating, or
Yeah.
sneezing and you're urinating, maybe even laughter.
Yeah,
If you laugh too hard.
jumping is a big
Okay.
one I see.
So at those points, they should call you to say, could you check it out?
Definitely.
Okay.
Definitely.
And then how do you diagnose that? Do they do an MRI? Like, how do you look to see if that floor is intact?
working? Yeah. So basically, I can kind of just walk you through an evaluation of pelvic floor physical therapy. So basically, I like to do like a 20-minute like free consult if you have any questions. Like, let's just see, was this a one-time thing? Is it something that's happening repeatedly? Do you have other symptoms? And now, whoops, I'm leaking urine.
Okay.
So we do a little consultation before. Come in. You come in, we do a really in-depth interview where I ask a lot of questions. And a lot of people are like, why are you asking me questions about my bowel movements if it's questions
pain
about
during sex,
or pain during sex, or any of which are really personal questions. And I fully explain why. And if you are uncomfortable answering that question, you say, I'm uncomfortable, and I drop it. Like, I have my patients kind of lead the session. This is, again, pelvic floor therapy is like really intimate. So we do the whole interview. We get kind of a nice background if you've had any abdominal surgeries before, any surgeries. And then we do a posture evaluation. So I talked about that pressure. Pressure can be like spread in a whole bunch of different ways. It can be pushed forward, it can be pushed back into your spine, it can be pushed down into your pelvic floor. If you have some like rib issues or rib flaring, like during pregnancy.
Oh yeah, do you remember that? Well, obviously we both remember that, but I remember odd things like my hip joints hurt, right? And my ribs, because you forget about that. You don't realize that your rib cage is going to go, whoa.
Again, to make room. And you're like, why did my bra size go up? Not in the way that I want it to.
And your shoe size, because of all the extra weight, your feet get a little like half an inch. Okay, so there's many different things that can cause these difficulties. It also looks like, the pelvis is like almost like a scale. Like a balance, right? So because your spine is here, and then it's like your tailbone, and it's attached with all these muscles and ligaments, right? How important is it, do you feel, that people do have good pelvic health?
It's extremely important.
Okay.
I mean, everybody talks about their core.
Right.
Everybody kind of focuses on the one abdominal muscle in the middle that shows your six pack. That is one muscle out of a whole system of core muscles. And your pelvic floor is part of your core. So we'll dive back a little bit. This big diaphragm muscle that's underneath your ribs is the top. The abdominal muscles are the sides. If you think of your core like a soda can, your abdominal muscles are like the sides, and then your pelvic floor is the bottom.
We never think about it, Corinna.
Right.
Just letting you know.
Yeah.
I mean, maybe not 100%, but I personally, I never think about it.
Right.
Okay.
So being that your muscles can kind of move up and down like this, having that length in your pelvic floor and having awareness to be like, okay, I can stop this by supporting my pelvic floor before I sneeze, before I do a jump.
Wow.
Then great. You don't have to deal with any urinary incontinence. You don't have to deal with pads, which can cause skin sensitivity and any and all of those things.
So it's head and shoulders, knees and toes,
Head,
and
shoulders.
pelvic floor. That's what I'm going to do. Head and
I
shoulders,
love
knees
that.
and toes,
I
pelvic
feel like
floor.
that's a great podcast.
I thank you. So people can come to you. You'll do a free evaluation for them, ask a whole bunch of questions, and then if they need help, they could then sign up. I guess, is it an hourly, weekly session people need? Or?
Yeah. So after like a 20-minute free consultation, you can sign up for an hour-long evaluation and then 45-minute treatment sessions. New York has direct access to physical therapy, so you can come straight to me. But eventually, you'll have to go to your doctor, whether it's your PCP or GYN or midwife or whomever, to get a script for physical therapy. But yeah, you can just come to me. We'll kind of figure it out. And the only part that I kind of left out of the evaluation, again, is that we might do a pelvic floor muscle exam.
Of course.
And that exam can be internal and can be external or can be excluded completely.
Okay.
Like I said, the pelvic floor can be addressed through many different ways. So if you're not comfortable, if you've had trauma in the past, if you've had any of those things, and you're not comfortable with anyone going near your pelvic area, that's fine.
Okay.
Consent
You're
is
there
huge.
to help.
Exactly.
You're there to help.
Exactly.
I thank you so much. I learned a lot of things that you just don't think about on an everyday basis.
Right.
But it's good to know. So, and many different things can cause that. Like you said, childbirth, aging, trauma,
right.
Difficulty if you've like broken something and you've stretched and you've moved your leg to, getting up on a motorcycle, anything that
any
can
type of chronic illness, like you were saying, anything, menopause. I mean, the two biggest hormonal shifts in a woman's life are postpartum and then again at menopause. And
absolutely.
That can affect moisture in the tissues. It can affect so many things and affect kind of daily activities.
Well, it's interesting because my mom had passed away from breast cancer early in her 40s, and I'm now 58. I've lived without a mom for the longest time. So there are questions that I'll ask my girlfriend, because now I did go through menopause, and I'll be like, "Can I ask you a question, girlfriend? Like, did this happen, or what are you thinking about that?" But pelvic health, you don't realize that going through menopause does affect your hair, your skin. It affects everything. So luckily, knock on wood, I made it through. I'm like in a good place, but thank you so much.
You're very welcome.
So Corinna, how can people find you? Where can we reach out to you?
So you can reach out to me. I have a website at www.perspectivespt.com. And I'm also on Instagram at perspectivespt.
Lovely. Wow. Okay. Well, thank you so much. It was very nice to have you here. I'm all shook up.
That's also a great one.
Hey, yeah. I'm all shook up. Thank you so much.
Thank you very much,
fun to have you here. Be well. All right. Stay tuned for more. We've been living it up right here with Corinna. Be well.